Hi, my name is Diwakar Kinra, and I'm an endodontist in private practice in Flint, Michigan, and I'm looking forward to talking to you, Kevin. Well, there's a couple different trends. There's trends that are a clinical trend, there's trends that are a practice management trend or a business trend. Let's talk a little bit about what an endodontist could expect to see when he leaves or she leaves dental school or endodontic residency. I see a lot of endodontists going into a bigger group setting. Starting off your practice like a private practice from scratch is becoming less and less. Though I think it's still a great option, it's not for everybody. What I do see is people starting to be the traveling endodontist, where they're going to other GP's offices and maybe they might have 3 or 4 under their belt, and then they're visiting them once a week or once every other week and doing all their endo for them. I see this becoming a really popular trend, at least on the West Coast, but I see it even becoming in more metropolitan areas. And it's great because the patients can stay right in the practice that they feel comfortable in, they're getting specialty care, and then they're getting the restorative care that they need right afterwards. So I see that as one of the bigger practice management trends that I've seen recently. I've also seen a lot of endodontists starting to group together. Sometimes as a specialist, you're kind of out there on an island by yourself. And I see a lot of endodontists grouping together under one umbrella, and because there's a lot of things that come in numbers, so there's a lot of times where you need an umbrella of dentists to help you get better pricing, better insurance coverage. And when you're by yourself, that's difficult to do. So I see a lot of people getting under, I would not call it a DSO model, but maybe a group practice mentality. I think endodontics has become easier in the sense that for the general dentist, there's a lot more products, technology, innovations that have become available to them as of recently. So with the advent of a cone beam or 3D technology, you really understand the anatomy of the tooth a lot better, knowing what you're getting into beforehand. So I think a lot of people are doing a better job with case selection because it's amazing what you see. For example, if you take a 2-dimensional x-ray and you do a treatment plan with it, and then you see the 3-dimensional version of that, there's actually about a 60% chance that you're going to change your treatment plan according to research. So just having that ability ahead of time to even know what you're getting yourself into really prevents you from doing things that maybe you would not even have started if you didn't have the technology there. And now with the advent of single-use files and single type of instrumentation, it's become much more straightforward on how to do root canal therapy. A lot of things are matching, where we have the file matches a gutta percha, which matches the canal size, and it's become just a lot easier. So I see that trend happening a lot, where people understand the way case selection works. They know what's going to work in their office, and they know that endodontics is probably one of the most profitable procedures in dentistry. And what surprises me is when somebody starts something that they shouldn't have started. And they're starting to realize that now that I know what I'm good at, and I know what I can do comfortably and profitably, because they're practice builders. You do a well-done root canal, your patient's gonna go and tell 3 other people. You do a bad root canal, they're gonna go and tell 10 other people, don't go to my doctor, they did a bad job. So you wanna make sure that everything you're doing is a practice builder, and it does affect your bottom line, I think, and everybody should be able to do some type of root canal therapy in their office. Now, I see the trends in education changing quite a bit. I see that people used to go on Google and research what's going wrong with their endo, or how should I do endo. Then now people are going to Facebook groups. I see Facebook groups that have 10,000, 20,000, 30,000 people on them, and now people are asking questions. I think that's a great way to get some information. But in reality, online is only going to get you so far. I think there's nothing that still replaces a good traditional over-the-shoulder, hands-on endodontic course. And I think that's where you need to be at. You need to at least take something that gets you in the right direction, gets you your fundamentals, and then bring some reps in, do some extracted teeth. Don't just jump into endodontics. I find that this is one of the trends that happens, is that if you get hired into a practice and you're a newbie and you're asked to do one of the most technique-sensitive procedures that's in dentistry, a molar root canal, and you have the least amount of experience because our dental school education just hasn't been able to catch up and teach everybody root canal therapy. You need to invest in CE and do that outside of your dental school experience.